For those who aren't familiar with EB, can you explain to us what it is and the type you have?
So there's 3 different types. There's simplex, recessive dystrophic, and junctional. I was born with recessive dystrophic, which means I'm missing the layer of skin that's vital in our makeup, which is collagen. The skin is the biggest organ on your body, so you can imagine it affects internally and externally. And it causes me excruciating pain, lack of and loss of mobility, and it's genetic, so I was born with this.
Okay. Can you just explain to us what a typical day is like for you?
So Monday, Wednesday and Friday I have bandage changes to make sure my skin is healthy. I'm prone to a very risky form of skin cancer, and I'm also prone to really high infections as well, so I have to be monitored very closely. They can take up to 4 hours every Monday, Wednesday and Friday, and then a day doesn't go by that I do not get bandages done. I get them done before I go to work as well, so it's extreme.
Okay, you mentioned extreme because, well, you know, I was just reading through your story again last night. Talk about the pain. Yeah,
pain in the last few years has really increased, and I didn't expect it to. My pain threshold was off the scale as a young child, but now I'm on 4 doses of high painkillers just to get me through the day, and that just kind of is the top of the iceberg really for me. It feels like the only way I can describe it feels like I'm on fire because it's nerve pain, and when it floors me, it literally drains me for the rest of the day. So I have to make sure I have painkillers in my system or I won't function.
The fact that 300 people in Ireland have this condition, the fact that I suppose that it's not as common and other things have stopped people, I suppose, up till now doing research into it and wanting to find, if not a cure, a more effective treatment, even when it comes to bandage changes.
Yeah, it's hard to go about it because there's so many factors that come with the condition. But I think in recent years we've found gene therapy is the way to go because that's how the condition starts in the first place, is a faulty gene with the 2 parents. Obviously, treatments have came my way in 21 years, whether that be ointments or creams or bandages. Nothing has, you know, obviously been a cure. It has improved some quality of life, and I always say this, personally, I don't think there will be a cure in my lifetime. But that's why I do fundraising and campaigning for the next generation, so no other child or patient has to go through this.
Fergal, we're delighted to have you on the show. You're carrying out research with RCSI and you're looking into EB. Can you tell us about the project that you're working on at the moment?
Yeah, I kind of delighted to, and I guess this project sort of came about from listening to Claudia's inspirational story and hearing more on an interview she had done about her experience. We focus in RCSI and my group on developing biomaterials to repair damaged tissues, and these, essentially, when we develop these materials, they're implants. We try to get them to mimic the tissues in the body, and then where there's a damaged or degenerated tissue, that because the cells in the body recognise it, they then begin to produce a functional new tissue. And we've had success there. We've brought technologies through to the clinic to human patients in bone and cartilage repair, for example. But over the last decade, we started to focus on gene delivery and using the same materials that we've developed to repair these tissues, but delivering gene therapeutics to target conditions whereby the genes were not behaving normally and proteins weren't being produced, or to use them to deliver proteins that might enhance tissue repair. So we have a project ongoing in skin repair for treating diabetes and chronic wounds. And we always thought that EB might be a potential target. So that's how the project came about. We got in touch with Debra Ireland. Debra gave us some funding from small pilot project that led to some encouraging results, and we've subsequently got more funding from Research Ireland and the Health Research Board to develop and grow this project, where we're using gene therapy in combination with our materials to hopefully provide a long-term solution for the condition.
Now, what does this advancement mean in practical terms for people like Claudia?
Well, our work is early stage, but what I would say is that there has been a big breakthrough in the last couple of years in gene therapy for EB, and there was a drug approved in the market for targeting dystrophic EB in 2023 in the US. Very encouragingly, that's been giving the European Medicines Agency has also started the process of approval. So that's encouraging for bringing a technology through to the market. From our perspective, we would be looking to combine something with that, with our biomaterials, to try and produce a longer-term outcome. What it would mean is that it might see a solution whereby you would see fewer bandage changes. Hopefully, eventually, this may take more time, a solution whereby the skin would begin to repair and produce normal functional skin. So like I say, there's encouragement in the field at the moment, but we'll see how this progresses in the medium to long term.
Okay, but you need funding.
We need funding. The field generally needs funding. Debra Ireland, who have done a wonderful job, and indeed the International Debra Society have done a wonderful job in supporting families, supporting people living with the condition, but there's never enough funding, and there's so many more demands back out there. So I would encourage people to please donate to Debra and to other scientific funding agencies to try and promote research in this area and in other conditions.